The first thing is scene safety. Scene safety means the scene is safe for you and for the patient also. Don't run directly to the patient because you don't know what caused that patient to collapse. He may got electric shock, so don't get yourself in danger. This is why we assure that scene is safe. So after you verify the scene, now you will check for the response from the patient. So what will you do is you gently tap on the shoulder of the patient, then check for the verbal response. And what will you ask in the verbal response? Very loudly. You will ask for count. That is, hello sir, can you hear me? Open your eyes. What is your name? Squeeze my hands. Now, if the patient is not giving any response, then what you do is, this is the third step. You have to call for ERS. You immediately call for ERS. In India, the ERS number is 108. It's not 911 and definitely not 000. Okay? These are of foreign countries. And tell someone to get an AED, that is automated external defibrillator. Now you will check for pulse. Please go for central pulsation and check for breathing. See, there are three pictures now. Number one is normal breathing and normal pulse. You only have to wait for emergency response to come. Now the second picture is pulse is normal but patient is not breathing. In this case, you only have to give rescue breaths to the patient. You will give one breath per 6 seconds. It means 10 breaths per minute, and check for the pulse for every 2 minutes. If any time you feel that there is no pulse, then you have to start chest compression also. This situation normally comes in opioid poisoning. Although this condition is not normal in India, but that should be in mind. Now the last scenario is no pulse and no breathing, or the breathing is shallow, or you can say patient is in gasping condition. In this condition, we start CPR immediately with 30 chest compression and 2 breaths. Each breath counted for 1 second. Till then, if you get an AED in time, then you have to attach the AED to the patient. Check for the rhythm when you attach the AED. How do you attach the AED? I will tell you after the lecture. Now, when you attach the AED, there are two conditions. Number one is the rhythm is shockable or the rhythm is non-shockable. If the rhythm is shockable, the AED machine will self-assess the rhythm and give the shock. After the shock, you have to continue the chest compression for 2 minutes and then you will check for the rhythm again. The AED will tell you when to check rhythm. Before that, you have to continue for chest compression. If the rhythm is still shockable, the AED will give another shock. If still there is no response, then you have to continue CPR till the ERS team arrive. In the scenario when the rhythm is non-shockable, then you have to continue CPR till the ERS team arrive. Now suppose you are the part of the ACLS team and you reach in time at the location, and just assume that you are well equipped in India also. So now what will you do? See, you will come and take over from the rescuer, and now you will assess the rhythm of the patient. Is it shockable or is it non-shockable? Shockable rhythms are ventricular fibrillation and ventricular tachycardia polymorphic. So the first step is give the shock. Please note that every shock will be higher than the last given shock or equal to the last given shock. Immediately after shock given, you have to start CPR at least 5 cycles, means at least for 2 minutes. Now, obviously there will be some help with you. So that person will access the IV and give injection epinephrine every 4th minute. And after the next shock given, you will start antiarrhythmic agent like amiodarone or lignocaine. As the recent research said, they both are equally potent. Okay, by the time you also need to find the underlying cause. Now, if the rhythm is non-shockable, what will you do is you continue to CPR, and after the IV axis, you give injection epinephrine, continue CPR. Likewise, you will continue till the rhythm comes or till the rhythm is shockable. So now the question is when to stop CPR. a general approach is to stop CPR after 20 minutes if there is no return of spontaneous circulation, means ROSC, or viable cardiac rhythm reestablished, and no reversible factor present that would potentially alter the outcome. This is all about CPR. Now we will discuss about AED. Okay, if AED is present, how would you attach the arrested patient? Okay, so the AED means automated external defibrillator. All the instructions are given by AED: where to attach, when to attach, at what side the pad should be attached. So there are two pads in the AED. Both should be attached to the chest as shown. So what you have to do is you just have to attach the pad after removing the cloths. Okay, and then the AED will assess the rhythm itself and give the shock accordingly. So now come to the drugs. There are only two drugs has been approved. Number one is epinephrine. Number two is amiodarone. The initial dose of epinephrine is 1 milligram. It means 1 ratio 10,000. Means 1 ml of epinephrine will be dissolved in 10 ml. And second one is amiodarone is given in VF, pulseless VT, and VT with pulse. Now the last thing